Hello, thank you again for joining us on Ask an Expert. We have Lacey Genta from Home and Community-Based Services this afternoon, and she'll be sharing her expertise with us. Lacey started in ChildServe case management 15 years ago and continues her work of heart today. Lacey is a BIAA certified brain injury specialist, pediatric palliative care fellow, an avid reader of the Iowa Administrative Code, and loves a good IEP meeting. Born an optimist, she is always looking for ways to simplify a problem and solve it. Lacey and her husband have 2 children. When not at work, she's usually at an ice rink, court, or field watching them play. Lacey received a degree in psychology, sociology, and anthropology from Cornell College, and has been working with families accessing waivers for 2 decades. Lacey, thank you so much for joining us and bringing your expertise. We're very excited to have you at Ask an Expert. Thank you, Lacey.
Wonderful. Yeah, thank you so much, Deb. I'm proud to be able to partner with Ask. So my role, I work at ChildServe, and my role there is I provide case management services to individuals on the brain injury waiver and the intellectual disability waiver, and I also support a team of case managers there as well. And ChildServe is an organization that serves children 0 to 30 with special health care needs. And so we serve individuals. We have 3 campuses here in Iowa. We have one in Ames, we have one in Iowa City, and I work out of the one in the metro here in Johnston. So that's just a little bit about me and my experience. And the goals today are really to talk about what is waiver, how you get a waiver, and once you're on one, what does it look like and how is it helpful? So at the end, I have a lot of resources on here. At the end, all my resources are listed, and then I'll provide my email address, and feel free to reach out and contact me anytime, or you can call ChildServe and ask for Lacey, and they'll find me in case management, or we've got a team of social workers that can also help anybody who has any questions as well. What a waiver is, it's designed to provide funding and services for individuals who have healthcare needs that without those services and supports, they would require facility level of care treatment. So without the supports of the waiver, they would need to be in some kind of hospital or facility. And so the idea is the waivers are there to provide services and supports to keep those individuals living in their family homes or living out in their community in waiver supported homes, things like that. So Iowa has 7 waivers. The ones that I'm most familiar with are the intellectual disability waiver and the brain injury waiver, because I work with those on a daily basis and have for 20 years. But in the past, I've also worked with the health and disability waiver and have helped with some of AIDS HIV waiver, elderly waiver, physical disability waiver, and children's mental health waiver. So in the human services field, we love acronyms, and so I often refer to them as HD, ID, BI, things like that, but just know that that's what I'm referring to. So this is just a visual, and I know it's busy and it's not meant for you to take notes on or write down. Really what I put it up here, and it's actually a two-pager. The reason why I put it up here is just to show that you'll see the waivers across the top, and then you'll see different services down the left-hand column, just to know that all of the waivers, they vary greatly between each other, and they offer different services. They have different caps, different amounts that you can access, and it should really be individualized to the person to an extent. At the same time, not all services are available under each of the waivers. So I have a link to this resource at the end of this presentation that you can take a peek at. But just know, if you know someone on a waiver and they're getting a service you're not, it could just be that your waiver doesn't offer that service, or it could be that that's an opportunity for you to reach out and figure out how you're going to get access to that service. So some of the services that are pretty common for families who access waiver are listed right here, and I'll just explain these a little bit here. So respite is designed to provide a break for the usual caregiver. There's different types of respite. There's individual respite, which is one-on-one respite. There's group respite, where it could be in the home or out in the community, but it's multiple children or adults with a staff. And there's also camp respites that are available through this group respite. And then there's specialized respite. So specialized respite is for those kiddos who have a medical need or require a more trained caregiver than your typical respite provider. And those are accessible under the waiver. SEL services, that's a skill-based service. So a lot of families are going to access SEL to work on skill building. So those skills could be anything from ride a bike to tie a shoe to cook your own breakfast. And a staff, the team's going to meet, they're going to come up with a goal, and a staff is going to help them work towards becoming independent in those skill areas that have been identified. Consumer-directed attendant care, we also call that CDAC. CDAC is actually, it's a service that provides care. So where there's different skills that are being worked on, this is really where SEL is teaching an individual how to become independent to do that skill themselves. CDAC is providing care for individuals who aren't able to do that for themselves because of their disability. So it could be very similar. So you could be using CDAC to make your breakfast, and you could also be using SEL to learn how to make your breakfast. I think with children and young adults, there is some room to have both access to both of those services. If you need support to be able to do that on a daily basis, but you also are in the process of learning how to do it for yourself, I do think that, there is an opportunity there to access both of those services through the waiver. CDAC really can't be for individuals who wouldn't be doing it. So a 2-year-old doesn't normally make their own breakfast, and so that's not a service that's covered under CDAC. That would be a family responsibility. At the same time, 16-year-old who doesn't want to make their breakfast but can, that would be another one that's not covered under CDAC. It's not a care because of their disability. It would just be more of an opportunity to figure out a better option for kind of scheduling, structuring that person's day. Another service that's commonly accessed is pre-vocational services. So these are skills, these are pre-employment skills, so skills that individuals would need prior to accessing employment. So some of those soft skills, communication skills, communicating with their supervisor, coworkers, interviewing for a job, some of those personal care skills of what do I wear to work, what do I need to make sure to do to take care of my body before I go to work, and then some of those community skills of how do I get to work, and when I'm out in the community, maybe once I have a paycheck, how do I know what to spend it, and where do I need to budget my money to be successful and productive within the work environment. Supported employment. So pre-vocational skills start about 16. We know that in IEPs, we start talking about transition at 14. And so these are just good times to start talking about what goals you have long-term for your child, or what if that child's able to advocate for themselves, what goals they have, and how do we work there. And one of those, so schools partner with waiver. Waiver can't replace school services, but they can definitely partner. And so some of the supported employment stuff would be outside of school. It can look like job coaching. It can look like obtaining a job, really creative networking and finding out what's going to be a good fit for that individual so they can be supported. And then transportation. So transportation is just another common skill. Transportation through the waiver is really designed for individuals who would be normally transporting themselves, but because of their disability cannot. So if you're 17 and have a job, and normally you would be driving yourself to work, but because of your seizure condition, you're going to need transportation, waiver can help with that. If you're 5 and you're going to a birthday party, typically waiver is not going to cover that. So if you need to go to school, school should be providing that. So transportation is really designed for older teens and young adults, and adults do those necessary trips. There's also a service called NEMT, so non-emergency medical transportation. That is designed for medical trips. So if Medicaid is covering your doctor's appointment, you would access NEMT to get to that doctor's appointment instead of waiver transportation. It's just NEMT is paid out of the Medicaid pocket, whereas transportation is paid out of the waiver pocket. So the trick for waivers for young children is that it can't be a replacement for daycare. The state assumes that if you have a 4-year-old that's in need of daycare, whether they have a disability or not, that would be a family responsibility. It also can't be a replacement for school. And so if you have school services that are needing support, then the school through the IEP or the 504 should be providing those services rather than through the waiver. Also services that are already covered by Medicaid. So an example that we've seen is a kiddo does really well in their speech sessions, and so the family wants to hire for some additional private sessions of speech. So their waiver and private insurance cover X amount of sessions per month, and they want to hire additional. Well, something that's already covered by Medicaid isn't covered by waiver. And that's just a small number of services that we at Childs are working with children and young adults. So those are the services that we see frequently. All right, and so for those people listening who don't have a waiver or would like to apply for a waiver, you can do paper or online, and there's lots of ways to submit it. So I'm just sharing this information here. The application is really the Medicaid application. It's the application for health coverage when you look at it online. You'll list all the household members, and it sounds really informal, but if you're filling out the paper application, you would just write on that first page which waivers you're applying for. So if you're applying for the HD, ID, and BI waiver, you're just going to write that at the top. And it sounds really informal, but that actually helps it to get where it needs to go a lot faster. If you're applying online, the option, you would check the box. It's in step 2. It says, do you have a physical, mental, or emotional health condition that causes limitations in activities? And you would check that box, and that sends it down the right path to get to waiver processing to get on a wait list. So once you've applied, actually what you'll get is a denial letter, and it's confusing for families. DHS sends those out automatically because Iowa has wait lists for waivers. And so you'll initially apply and you'll get a denial letter just saying that you're denied services today because you're on the waiting list. But when a slot opens up, they'll reach back out and contact you. So in Iowa, we have 2 different populations for Medicaid. When you're on waiver, you get Medicaid. Even if your family, because of your household income, doesn't qualify for Medicaid, the specific individual on the waiver would get Medicaid in addition to their waiver services. We have some families where just the child on the waiver is accessing Medicaid, and we have some families where the whole family is accessing Medicaid because of their eligibility criteria is met. When you get a slot is when you have to determine your waiver eligibility. I would just encourage families, if you're thinking about applying, but you haven't got a psych eval done, or you don't have all the medical documentation pulled from your file cabinet yet, I would go ahead and apply as soon as possible to get on that wait list, because it's not until you have a slot that you're going to actually be proving that you have a child or you're helping an individual to access waiver that they meet eligibility criteria. For Iowa Medicaid, the 2 choices of managed care organizations are Amerigroup and Iowa Total Care, and both of them have member services available. For those in the fee-for-service population, you would just be working through Department of Human Services, which houses the Iowa Medicaid Enterprise, which they also have their own member services as well. There's a few different ways to qualify for fee-for-service, to be in that population of fee-for-service individuals where you'd be excluded from a managed care organization. The most common way is to access the HIP program. And the HIP program, I have the link to their site at the end of this presentation. It's a health insurance premium payment program. It's designed for individuals who carry private insurance for that individual who's also accessing Medicaid. And the idea is that it saves Medicaid money for you to continue to carry your private insurance. And so they're going to help pay a portion of your private insurance to continue on that private insurance in addition to Medicaid. So it has to be cost effective for the program so families can apply. And once you're approved for HIP for the year, then you would fall into the fee-for-service population rather than the MCO population. What we kind of talked about, you apply, you're on a waiting list, and you wait to get a slot. Once you have a slot means that there's openings for that waiver for new people to access those waiver services. The first step is to prove your eligibility. So for example, for the brain injury waiver, you would have to have a qualifying brain injury diagnosis. For the intellectual disability waiver, you would have to have a psych eval that determines that you have an IQ score, full scale IQ score, that's within the range of intellectual disability. Kinds of documents that demonstrate your diagnosis. Then there's also what's called a level of care assessment. So that's that LOC, another acronym. An LOC, it's an assessment in the state of Iowa where you currently use two different assessments. One is called the SIS, so Supports Intensity Scale, and one is called the Inter-Array, and it's coupled with what's called the Mayo Portland. So both of these are assessments that are designed to identify strengths and weaknesses to determine if there's a level of need that would qualify you for a waiver. In the MCO population, the MCO will provide an assessor to do the level of care assessment. For the fee-for-service population, the state contracts with a company called Telegen. They'll provide an assessor to do those various assessments. After the assessment, the next step is to determine the care plan for that member. And ideally, you would meet once a year to develop that. And then if there were changes in the plan, it's a working document. You could always meet more often, or goals are met, or service needs change. You can always pull the team together, similar to an IEP meeting. The interdisciplinary team, the members should be able to choose who participates in their planning and their care planning. A lot of times it looks like providers and family members and people who are close to that person who can come together and develop a plan for the year. The other component from a team perspective is also the case manager. There's lots of different names for them. Some people call them TCMs for targeted case manager, or MCOs refer to them as CBCMs, community-based case management. That person that's going to be your navigator to help you through all of the services that are considered human services here in the state of Iowa. It's a messy, elaborate system, and so case managers are designed to kind of help you navigate through that and connect you with resources, get the supports, obtain the services that are needed, and then that person's responsible for authorizing those services, showing that we've got the documentation to support the need, and then authorize those services so those can be provided to the individual. Providers, families, and individuals should have a choice in the providers that they access. So it's always a red flag if you're being directed only to one provider for a service, or if you're not being given a choice. In some smaller towns, rural areas, there isn't a lot of choice because of location or accessibility, but there should always be a choice, and you should always know what your options are. There's traditional providers, so those are the providers that are child service one. Traditional providers that they are contracted to be a waiver provider through the state, and they're going to do the hiring, the firing, the training, the coordinating, all of that. Another option is what's called CCO, the consumer choice option. And that's where individuals and families can direct their own services. Rather than going through a traditional provider, you could opt to do the CCO route, where you are responsible for doing your hiring of staff, your firing of staff, your training of staff, signing off on their time cards, all of that. You would work with an independent support broker to develop a budget, and you work with the case manager to determine and authorize the services that are on your budget. And that's just an option. You can have traditional providers and CCO. You can have all traditional, or you can have all CCO. CCO could be its own webinar, just because it's a pretty unique option here in our state, and it's in other states as well. But a lot of families, especially if you're hiring family members or family friends, that can be a good option to just have more control over your own services. So if things aren't going well, first step is to always talk to your case manager on waivers. There's a lot to know, there's a lot to share with families. And if your case manager isn't able to do that, then they should be relying on their team to go back and kind of help problem solve and be that navigator to kind of facilitate a good plan and a good support network of services. I always suggest that families put any kind of grievance in writing. You can make the phone call, they have a phone line you can call, but I'd always follow up with it in writing as well. If you are receiving a denial of services, well, let's say the team determines that X service is needing, and then you get a denial for that service. That would be an option if you feel like the service really is needed but isn't being provided to the individual that you're supporting, then that would be an option for an appeal. And appeal is just a formal way to talk through, could this be overturned? If DHS or the MCO is making a decision that you don't agree with, they would involve an administrative law judge that can help determine, is there an option to overturn and get the service that was denied? There's also what's called an exception to policy. So an exception to policy, all the waiver policies are based on code, Iowa Administrative Code. And so if you have a need that's not being met within the current rules of how the waiver is laid out, that would be an option to file an exception. You could say, based on my needs, I have this need that isn't available through the waiver the way it's written right now, and I'm asking for an exception. That one families can fill out, individuals can fill that out for themselves. My advice is to always consult with someone who is familiar with waiver to know exactly what it is that you're looking for an exception for. It's easy to deny something if you get sometimes it's a game of words. It's easy to deny something if you don't know exactly what you're asking for an exception for, if you don't know the original rule that you're to be met. And so I would always consult with someone who's familiar with waiver if families are going to fill that out on their own. But those are just options if you feel like you're not getting your needs met, ways to reach out and ways to look at it differently or try to think outside the box if you're feeling a little pinned to what services are being offered to you. And right now, during this pandemic, there are some expanded services. It's a temporary extension of services. And what we understand is that while there's still a global health emergency in place, that additional services can be authorized. Knowing that this is temporary, our understanding is that once the public health emergency ends, the state will start pulling back within 60 days some of these waivers, these exceptions that they're currently allowing. So some of those are going over caps. There's a lot of telehealth services that are happening right now to where things that used to be happening in person are now happening virtually or over the phone. There's also an option if you have no other staff. It's never been done before, but if you have no other staff and you're a parent with a minor child, you could become a staff person for your child. And then there's also the option, respite typically can't occur while the usual caregiver is working, but during the pandemic, if the pandemic is causing you to work from home and you still have a need to care for your children, respite can occur while you're working from home during the pandemic. So these are some temporary things, but not everybody knows about them, so I just wanted to add those here. So the last page is just resource information. There's good information on the DHS website. It's kind of hard to find sometimes, but it's out there. There's the waiver packets, which is kind of a condensed, summarized version of each of the 7 different waivers in Iowa. And I would have you guys look at that page. That LTSS, that's long-term services and supports, that comparison chart, that was the visually heavy one that I shared early on. That's available out there, and you can look at, oh, should I apply for this waiver? This one doesn't meet my needs because these are only services authorized. Or you can look at how the waivers are different if you're selecting between 2 different services. There's the application if you want to pull it off, and then if you want to submit it online, there's the portal. You'd have to create a user login there. If you're interested, if you have private insurance and have Medicaid, there is the HIP program, and you can apply for that. I would also say if you already have Medicaid, but don't have a waiver, there is a shortened condensed version. There's a one-page application to ask for a waiver, to be put on a wait list for a waiver. And I would encourage you to use that rather than they have all of the information. If you're already Medicaid eligible, they have all that information already. You can fill out a shortened version of that form. And right now through DHS, they have frequently asked questions in regards to the temporary flexibilities offered for COVID-19. And so I would lead you over there if you had questions of, wow, we're in this really tough situation because of this global pandemic, and how can we get our needs met? They have a lot of good resources, a lot of good questions that have been asked that they've put out their answers in writing that could help support if you've got a unique situation and you're looking for ways to problem solve that. And my email address, Deb can share it out with this webinar. It's LACEYMO, LacyMo at childserve.org. And you can always feel free to contact me. Again, like I said, you can call ChildServe and ask for Lacy and they'll get you to me. Or you can send me an email. I'm more than happy to help families apply for waiver and more than happy to answer questions about waivers. That's all I have here today.
Thank you, Lacy. That was great information. In fact, I know Erin has been very helpful trying to get some of the links that you shared, and it makes me even more motivated to get that information out there for families. So thank you so much. So we've got a couple of questions. And so the first one is, how are the pre-vocational skills and supported employment offered by the HCBS waivers different from the PREETs offered by Voc Rehab under WOI?
I appreciate that question because schools are always trying to figure that out when they're working with IEP teams. So if a individual has a goal on their IEP about employability, then really the school should be figuring out ways they should be working with Iowa Voc Rehab. They should be working within their districts to provide those services and supports. So during the school day, those are services where you're partnering with schools to get those needs met. You're partnering with IVRS to get those needs met. And district to district, there's been a push to have schools do more of that employment piece, and it's been hard for schools. Waiver does have supports, but not all of the waivers do in those different areas. And so it should be a partnership. So if it's transportation to work during the school day, that's the school. If it's transportation, you get a job and you're doing some after school work, that can be waiver. And so it should really be a partnership and a discussion. Both of them can be very supportive for an individual with an IEP with employability goals. The trick is the funding stream, of course. The money is always the driver. And so the schools and the waiver just have to be smart about following the hierarchy of who pays for what. And so a lot of times it starts with schools and IVRS and then moves on to waiver after that.
Great, thank you. Yeah, tricky question. Question we have is there a good way to tell how long the wait will be based on the data about how many are in front of you?
Actually, the link to the 7 different waivers in Iowa, if you scroll down, there's a wait list link and you can pull up the application dates that they're currently serving for all 7 waivers. And so it doesn't have a list of names of how many people are in front of you. It just will say, like for the ID waiver, the last application that we opened a slot for was, April 2017, something like that. So you'll just know based on your application date, kind of how long you have to go, how many years are on the wait list. Unfortunately, it's a long wait. There is a form that can be filled out if you have emergent needs, where you can skip up higher on the wait list. It's a form that if that individual it would have to be at the emergency level. It's called an emergent needs form. If the caregiver is at risk or the individual's at risk because they're not able to access waiver, then that's a way that individuals can bump up the list to get access to waiver services sooner. But on the website, you can see the last application date and kind of base your timeframes on that. Another way is always calling income maintenance worker, income maintenance through DHS, and always confirm that they have your application and that you're on the waiting list still. You can do some checking that way as well.
Great. Another question for you. Can I switch which waiver my child is on?
Yes. So it's not an immediate thing. So if you are feeling like there's 3 different waivers that can meet your needs, you apply for all 3 of them. And the first one comes up, and let's say that's the brain injury waiver, but you're really looking forward to the intellectual disability waiver. You can be on the brain injury waiver while you're still on the ID waiver wait list. And then when a slot comes up for the ID waiver, you can just let the worker know at that time, nope, I either want to stay on the BI waiver that I started with, or yep, I do want to make the switch and switch over to the ID waiver. It's all based on slot availability. And so a person who's on a waiver would still have to follow the wait list to switch to a different waiver, but there's definitely the option there. So if you're on a waiver and you're not happy with the services, or you feel like you need a different waiver to access different services, and you're not on the waiting list, then I would, if you're on a waiver already, you're on Medicaid, and so I would supply that 1-page waiver request form, and you can switch over as soon as your name comes up and you get a slot for that waiver.
Very helpful information. And another question here, what should I do if I can't get in touch with my case manager?
So fee-for-service case management is either DHS, or DHS contracts with, in Polk County and Metro, they contract with a couple other agencies like ChildServe, Link, CSA, all of those. But in the state of Iowa, if you're in the fee-for-service, there should be a hierarchy of another contact. So how case management works is team-based, and so there should be an access point. If you're with an MCO, call member services, and you can just say that I can't reach my case manager, and then ask for the case management supervisor. And then they should be able to link you to your case manager. I think, unfortunately, with how often eligibility changes and how many people are moving between waivers and moving between MCOs, MCO case managers, their caseloads fluctuate frequently, and they don't always see those changes, or they're not always aware if somebody new is added to their list. It's a unique system. Some agencies support about 30 people on waivers, some support like 80 people on waivers. And so if you're just getting another name added to your list that you didn't know was there, you may miss contacting that person. And that person, if they've just coming off a wait list, they're anxious to get services started. And so they're going to want to be contacted. So I would always call member services and explain the issue, and make sure it gets taken to the next level to talk to a supervisor to make sure that that case manager knows that they're assigned to you, first of all, and that they're getting back to you timely to get your needs met.
Good old-fashioned communication, and don't give up.
Yeah, it can be tricky.
Yeah, it can be. It can be, especially in this COVID life right now.
Yeah.
Well, I think, Lacey, that was it, but this was super helpful. And thank you for the work that you do. I can tell you're very compassionate and passionate about what you do.
Well, thanks. I appreciate the partnership. I'm glad that all the people listening are already connected with Ask in some way, because you guys are a great resource for families. So thank you for that.
Well, thank you. Thank you. All right. Well, have a good day, and thank you for sharing your expertise with Ask an Expert.